With going through a lot of ideas and just needs for potential projects, Christina and I became very interested last year in trying to do something related to depression, or more specifically major depressive disorder and bipolar disorder. And there, for the people with bipolar disorder who present first in an episode of depression, it's very common, because if they haven't had one of the symptoms of like the major symptom of bipolar disorder, mania, before, they're very commonly misdiagnosed as major depressive disorder. Up to 40% of those patients get misdiagnosed as major depressive disorder. And that means that they would get also the treatment that normally people with major depressive disorder receive. But in that case, it's this is a very serious problem, because those medications in people who actually have bipolar disorder cause them to have manic episodes and basically worsen their symptoms, and they can even become suicidal. So it's very, and from there basically we found the need, a very important need, that it's necessary to differentiate people or patients with major depressive disorder and bipolar disorder in a depressed state. Because otherwise they would receive the wrong treatment. And I mean, at this point the diagnosis of these disorder is based on symptoms, but the symptoms of depressive episodes can be quite similar. So from that alone, it's not possible to differentiate them. So we were thinking and hoping that maybe if we can learn something more about the neurobiology behind these disorders, that maybe it's possible from there, like doing a imaging study using PET, and that we might be able to extract some biological information that can then be used to develop a biomarker for these disorders.